In this episode, I'm going to answer your biggest concerns about Medicare. In this episode, I'd like to talk to you about when to sign up for Medicare, or do I sign up for Medicare? That's the questions that I get asked the most when it comes to people getting around the age of 64, 64 and a half. You are actually eligible for Medicare the first day of the month that you turn 65. So if your birthday was February the 18th, your Medicare is going to kick in February the 1st. You're going to be eligible for Medicare if you have worked at least 40 quarters in your lifetime, paid into taxes at least 10 years, or you were married to somebody who paid in the FICA for 10 years. That is your eligibility for Medicare. There's 51 million people on Medicare as we speak. So 3 to 4 months before you are going to turn 65, you want to go down to your local Social Security office and talk to them about signing up for Medicare Part B. You don't really have to sign up for Medicare Part A because that is going to be automatic because there is no cost for Medicare Part A. Medicare Part B is going to cost you a premium. But 3 to 4 months prior to your 65th birthday is when you're going to want to do that. Because if you miss the enrollment in Medicare Part B, you're going to be penalized 10% on the premium for the rest of your life. So it's very important that you enroll in Medicare when you become eligible, which is actually the first day of the month that you turn 65. But they'll allow you to enroll up to 3-4 months before you turn 65. The prescription drug program, Medicare Part D, is also very important that you enroll in that when you become eligible for Medicare Part A and Medicare Part B, which is the first day of the month that you turn 65. Because there's also a penalty involved if you do not enroll in Medicare Part D when you become eligible. So the best way to do it is to go down to your local Social Security office and let them know that you want to enroll in Medicare Part B and Medicare Part D. I have a lot of people ask me, well, what if I'm still working, Rodney? What if I'm on group health insurance? If you're on group health insurance, you need to sit down with an advisor like myself and determine, is the group health insurance better coverage and more cost effective or less cost effective than me enrolling in Medicare? That's a very important determination because this is going to affect your health care for the rest of your life. One of the biggest decisions that you have to make if you're currently working and on a group program, or if you're married to somebody who's on a group program, is when I turn 65 and I'm eligible for Medicare Part A and Part B, do I stay on the group health insurance or do I enroll in Medicare? Well, that's a decision that you need an advisor to help you with, and that's what I've been doing for 27 years. It's a pretty tough decision. We weigh out the cost of staying on the group versus going on the Medicare, and we also have to weigh out your health situation and whether Medicare is going to be better coverage than what the group is. Those are very important decisions that you have to make, and you should be considering those decisions about 3 months before you turn 65 years of age. I'm R.L. Jones. I'm here to help you with those decisions, and that's your financial news for today. So if you like this video and you want to learn how Medicare works, I'd love to have a conversation with you. Just give me a call or shoot me an email.